Good morning. Good morning, everyone. Good morning. Morning, can you hear me?
Yes.
Morning. Okay, we want to get underway. Hopefully everybody's got the agenda for this town hall, senior town hall meeting. If you have to pick up an agenda, please pick up one after you read at the sign-in table. So I'm Miley, County Supervisor, as well as the President of the United Seniors, and just want to welcome all of you to this town hall meeting this morning. You know, we try to do one of these once a year out here in the unincorporated area. So to bring information to older adults, as well as those who are concerned, care for, and love older adults. And we were able to get the word out pretty extensively. One thing I think we failed to do is maybe put it in the San Leandro Times, the Castro Valley Forum. Otherwise, I was told the word got out pretty extensively. So I just want to acknowledge initially the exhibitors that are here this morning. We have Alameda County Housing and Community Development. Raise your hand. Thank you for being here. She's got a lot of good, useful information. We've got the Area Agency on Aging. Raise your hand. You have a booth? Okay, all right, there you go. Raise your hand, all right. Is that Jamie and Elisha? Okay, all right, thank you. And then we've got Bart. Bart, raise your hand back there. Okay, Mr. Bart. Michelle and Bradley, yes. Michelle and Bradley. Then we've got Center for Elders Independence. Raise your hand. Randy is also on the board for the United Seniors as well, longtime board member. Then we've got Hayward Recreation Department over there, Hayward. And we've got Daniela. Okay, thank you. Then we've got Alameda County Behavioral Health, Older Adult Division. Okay, over there. Julian, thank you. And then we've got chapel training, United Seniors, and we'll be hearing from Shanita a little bit later. And then finally, I think AC Transit. AC Transit back there in the corner. Is that Kim? Yeah. All right, very nice. So we want to thank all of you for being here this morning to provide information to seniors. And keep in mind, I'll announce this a few times, but on June 13th is the United Seniors 34th Annual Convention. This year we're going to be holding our 34th Annual Convention at the Cherryland Community Center on June 13th, which is a Friday from 8:30 to about 2. So we want to encourage the exhibitors and all of the attendees here today and others to join us for our 34th Annual Convention. It's an opportunity for the United Seniors to report out on what we've done, maybe what we're thinking about doing, like taking care of some business like the officers, having some presentations. It's a very good event. There'll be lunch provided as well at the convention. So if you haven't gotten that flyer and the information, that's at the registration table. The 34th Annual United Seniors Convention at the Cherryland Community Center. We try to rotate our conventions and hold them in different parts of the county. Usually we hold them in Oakland, but we've been out at the fairgrounds. We've been here at the Castro Library. We've been at Eden Church. We've never been at the Cherry Community Center, so that'll be the first time we've actually been at the Cherry Community Center. So looking forward to that, our 34th annual convention. So I do have some of the United Senior Board members here with me. Nate Harrison, Cecilia, Lois, I mentioned Andrea. So we have some of the board members and leaders from the United Seniors here this morning as well. And then also, every fourth Friday of the month, no, third Friday of the month.
Fourth Friday.
Fourth Friday. Every fourth Friday of the month, from 10 to 11, Tanya convenes our Eden Area Senior Action Group. And it's a virtual meeting, 10 to 11, every fourth Friday of the month, 10 to 11, our Eden Area Senior Action Group. And I just saw May come in, Carol's on the Eden Area Senior Action Group. There might be a few others, but we encourage you to join and participate in our Eden Area Senior Action Group that meets the fourth Fridays of every month, 10 to 11, and it's a virtual meeting.
How do you register?
Go see Tanya. Yeah, Tanya, get you registered. We'd love to have folks attend that meeting virtually. It's open to anyone who's a senior or anyone who loves seniors. I always like to say that. We're all about older adults, but we're also about folks who love older adults. And I like to tell, say to everybody, if it's good for seniors, it's good for everyone. Would you agree?
Yeah.
If it's good for seniors, it's good for everyone. You don't sound like you mean it. If it's good for seniors? Yeah. Are you sure if it's good for seniors? Yeah. Yes, because I always tell folks, if you're blessed enough to live long enough to become an older adult, you want your quality of life to be good. And so what we do today, even if you aren't an older adult, is really laying the framework and groundwork so that you can have a successful life should you be fortunate to live long enough to become an older adult. Because we're all about folks aging gracefully, aging well, and continuing to have a good quality of life when they become a senior citizen. And then one other thing I'll announce, and I'll announce this again later on, is on September the 25th, we'll be holding our 22nd annual Healthy Living Festival at the Oakland Zoo. How many of you have been to the Healthy Living Festival? Practically everybody. It's a free event. Lunch is provided. We have about 100 exhibitors. I'm sure some of these folks have exhibit there. A lot of useful information at the Oakland Zoo. People can drive themselves there. You can get rides there. She can arrange public transportation. We charter buses. September 25th, 9 to 2 o'clock at the Oakland Zoo. Seniors come in from all over the county. We generally have about 3,000 or more participants at the event. And once again, it's open to seniors who live in Alameda County. You need to register, and when you register, if you want to bring a grandchild or a friend or a family member, that you can do that, but they need to register with you. So we have a count, because this is an event for seniors, not for non-seniors. But we do encourage seniors to bring family, friends, caregivers, partners, anyone, but they have to come as a registrant with the senior themselves. And we haven't opened up registration yet. We will be opening up registration probably the first part of July. But the flyers are there so you can get information and begin to be thinking about it. And there's entertainment. It's just a big, beautiful day for older adults.
Free entrance to the zoo.
Yes, Carol's right. You get free entrance to the zoo. Those who want to go and visit and walk around the zoo, ride the rides at the zoo, see the animals at the zoo. I mean, all that's there too. And it's all part of seniors networking, being able to socialize, not being isolated, having just a wholesome day at the Oakland Zoo. And we're very fortunate to have the Oakland Zoo partner with us and host the Healthy Living Festival. And we also try to take care of some issues that affect the quality of life for seniors as well. Sometimes there are petitions that are being circulated. People can sign cards to send to officials about issues and concerns. I mean, there's a lot of things going on, so we once again encourage you to be there. Now, I'll go back and emphasize that along with the convention again a bit later. So now what I'd like to do is, I'd like to invite Nathaniel Harrison. He's our first vice president for the United Seniors, and he's going to give the credentials for the United Seniors to get us started.
Thank you, Supervisor Miley. Good morning to each and every one of you. As we know, Monday is Memorial Day. I know there's at least 3 other veterans in here. So always remember your fallen veterans on Memorial Day. God bless you all. I'm going to be reading the credentials. USOAC, celebrating 39 proud years of organizing for older adults' quality of life. And we empower seniors through leadership, development, community organizing, outreach, education, and training. Our mission statement: to provide institutional support for seniors to collectively participate in the public arena, to act from a positive position of strength, to enable the elderly to address the critical issues and to change the conditions that impact their lives. Our vision statement: to help enhance the quality of life for all Alameda County seniors, economically, socially, physically, mentally, now and for the rest of their lives. Who we are. USOAC is a grassroots, multi-ethnic, intergenerational nonprofit organization focused on issues of concern to Alameda County seniors. USOAC educates, mobilizes, and enables seniors and their allies to address the issues that affect their quality of life. For over 35 years, USOAC has collaborated with the disabled and youth communities, senior services providers, and others to address shrinking resources for older adults. Those in Oakland know that they cut the hours of our senior centers, so services for older adults are shrinking. At the local and regional levels, USOAC has served as a catalyst for positive change, contributing to the betterment of senior citizens and the broader community. USOAC has more than 13,000 members through a multitude of individuals, chapters, affiliates throughout Alameda County. And thank each and every one of you for coming to the town hall meeting this morning.
So thank you, Nathaniel. So I'd like to bring Shanita Chu up. Shanita is our travel trainer, organizer. She's been with United Seniors for more than a dozen years, and she's a travel training specialist, and she does an excellent job. She's very passionate about travel training, and so she's going to give a presentation, a mini travel training presentation. While she's coming up, I want to also mention back at the CEI table is a survey, Age Well in Oakland, a 5-year strategic action plan. So if you're interested in picking up the survey form, filling it out, it's back at the CEI table, a survey form, Aging Well in Oakland. So I'm going to have Shanita come on up, and as I said, she's our travel trainer, and we really feel travel training is important because if seniors are isolated, if they lack mobility, if they aren't getting around, that's a means of being disempowered. We want seniors to continue to be mobile, active, and not isolated, and have that ability to feel empowered in that way. And so that's why we put a lot of emphasis on travel training. So turn it over to Shanita.
Can you all hear me?
Yes.
Okay. And Tanya has my presentation up. Thank you, Tanya. I'll let you know when to flip. Nate gave me a few extra minutes here, and so I would like to tell people, because I am also the membership coordinator at United Seniors of Oakland, Alameda County, and you know, as Nate Harrison mentioned, that we have over 13,000. So if you want to be a part of that 13,000, let me know. I have applications back there. It's only $12 a year, but today you can get it for 10 because I ain't got no change. Have no change, I'm sorry. So, you know, it's easier to get 10, and if you have 20, you get 2. And also, too, we have the annual convention program booklet today. And if you just want a patron or your name listing in there saying congratulations, that's $38.50, and today you can get it for $25. Discount, yes. So, and if you want to add, we're selling ads here today too for, Andrea, did you get an ad this year?
No, I don't know.
Yeah, okay, well, you're gonna get one today. Okay. And Bart, you know, you guys are way in the hole with us, so. They haven't been in our events for a long time. They've got a new person here, and he says he's gonna start coming and supporting our events, so welcome back, Bart. Anyway, this is a mini travel training, and it's up here, so I'll be facing you and talking because I have the same thing here. My name, the United Seniors of Oakland and Alameda County, and where we're located, and we have an office and my direct line. The office line you can call for other things, and that's Miss Mary back there in the corner. She'll pick up that line. And then my line here is the direct line, and I have a cell phone. So, you know, if you work for Supervisor Miley, you have 2 cell phones. I have my personal cell phone and this cell phone too. So you can call me 24 hours a day on that phone. I may not answer, but I don't know. So, because I'm sure it's an emergency. Next slide, here we go. They've already talked about all this that we do, the United Seniors of Oakland, Alameda County, but I just wanted to say it again because I'm here and I did it. Empowering seniors through leadership development, community organizing, actions, advocacy, outreach, education, and training. And at that time, we were celebrating 38, but we are now celebrating 39 proud years of organizing for older adults for their quality of life. Next slide, please. Many older adults, their driving skills aren't quite what they used to be. There's so many reasons why people take travel training. At first, it was just to transition seniors from driving to taking bus and BART. But now seniors need to learn how to get around, get to and from doctor's appointments, and they rely heavily on transit. I know that I right now am transit dependent, but I'm gonna tell you something, I'm gonna give me a car because I waited 46 minutes for the 7 the other day. And I'm saying this, and I know Director McCauley is here today. It's not in your area, but you know, this is my life's work right now, and this is what I advocate for, and I'm getting ready to retire, and I want a good transit system in my area. So travel training is not just about getting on the bus, the BART, the cable car, and the ferry. It's about advocating for your community and also getting good transit in your communities. So back to as we age, our reflexes may not be as quick, and we know that. You drive less at night, and you don't drive in heavy traffic. You don't drive so fast, and you double check your medication and take your driver's safety course. Well, one of the things that you can do is travel train with the United Seniors of Oakland and Alameda County. In addition to all these things, drive less at night, don't drive in heavy traffic, don't drive so fast, yada yada. But the fun thing that you can do, and I always say fun because it's fun at the end, but travel training is one of the things that you can do in our community, in Alameda County, in Slide County, please. We always having some sayings around the office, and I came up with this one. A good travel trainer will show you how to get around. A great travel trainer will empower you. I said that. So I did. I did that all on my own. I would just sit there one day. But here, travel training empowers older adults with skills and competence. And I was telling you, many people travel train for many reasons. Grizz back here, who is on Supervisor Miley's staff, I just travel trained 3 generations of her family to get around in the Bay Area, and if they want to go outside of the Bay Area. But they need a little more travel training, so I have to go and do a follow-up. So that's another thing that we do. We oftentimes, as a team, we follow up to find out what you're doing, how you're doing, if you're traveling, where you're going, how you're getting there. So we often use AC Transit, BART, SF Cable Car, SF Bay Ferry, and other forms of public transit. And lately I've been on other forms of public transit. I've been on the VTA system, I've been Sacramento system, County Connection, you name it, I've just about been on it. And Clipper cards are accepted in all these. And if you don't have a Clipper card, you can get one today, either from Kim back here at AC Transit. And if her line is too long, you can always go to BART, and they're giving out senior Clipper cards today. They're free, so go get one if you don't have one. Next, planning. Oh yeah, I am on that page. Mine is just small. Planning. We do trip planning. A lot of times people will call the office and want to know how to get someplace. The other day I was out and about, and a gentleman was told wrong directions from AC Transit because their customer service center is in Iowa, and so sometimes, you know, they have some problems with getting us where we need to get to. So he was giving wrong directions, and I have to do that. But one of the planning things is just getting people accustomed to the Bay Area and riding. Transit is not so bad, it really isn't. And on the weekends, and they really should put more buses in on the weekends, because people tend to travel on the weekends just like people travel during the week. People who don't have transit and are transit dependent and who work all week just riding back and forth to the city, well, they want to get around in the Bay Area. So when they use transit, they're waiting out there 46 minutes to an hour for a bus sometimes on the weekends. So I'm not saying that it's the best thing, so sometimes you have to have patience with the with learning how to use it. So that's another thing. But if you need to learn where to purchase your Clipper cards, you can purchase them at AC Transit Customer Service Center at 1600 Franklin, Walgreens, and at the Lake Merritt BART station. So that's about where you can get. And you can also load your Clipper card on, there's instructions there on how to load your Clipper card for Clipper Cash. These are the four forms of transit that we use to learn our skills on. AC Transit, sometimes we use a Transbay, sometimes we use local. BART, we use a lot of BART. Cable car, and the East Bay Ferry. So those are the ones that you learn. We also learn emergency planning, to how to get out of a situation if you're stuck over in the city like I was back in the earthquake days, and how to get out. And a big part of that is using Salesforce Center. Next. The benefits, everything is free. Plus you get a $40 Clipper card so far, you know, and if they happen to raise the rates to, we also increase our rates. So that was written in the grant because I know that the fares might be going up soon. I haven't heard anything about it. I'm keeping our fingers crossed that they don't raise our fares, but they always say they don't, and they do. But it's okay. It's okay. That's why we give you guys $40 Clipper cards. It kind of helps, you know. Traffic training can be beneficial to most everyone in all communities, not just Alameda County, to familiarize yourself with available transit options in the community. So, next slide. I have these books back here for everyone, if you want one. They're only good until August. They're going to be changing. This is Access Alameda Guide. It tells you about everything, anything you want to know. It tells you about ADA, paratransit, how much things cost, all about public transit. And then it has each city in here, like San Leandro, if you want to know San Leandro, Pleasanton, Oakland, Piedmont, Hayward. Danielle, you know your number is in here, huh? So yes, they have, and which systems that can be used at each of those facilities. So we have those back there. And this is just another extension of how far we all go with this book, Albany, Berkeley. It starts all the way up in Albany, and it goes all the way through Pleasanton, Dublin, Livermore, Fremont, Sunol. So all those are inside of this one book. And I have, and it comes in different languages. So if you take travel training, you will need to have a senior Clipper card, and there's 3 spots that you can go get them, aside from getting them today. And if I were you guys, I'd get them today with Kim or Bart. What's your name again? Michelle. Kim and Michelle are back there to give you guys Clipper cards. Don't you miss this, Andrea? She used to do what I'm doing for Oakland, yeah. Next slide. This is my information. You can jot it down real quick if you have some questions. It'll be up while I'm still up here if you have any questions. No questions?
Any questions from Shanita? She'll be here the entire time, so if you have any questions, we'll bring her back up. But any questions now?
How to get a senior card?
You don't have a senior Clipper card?
I never heard about this.
Oh, okay, see, either Kim back here or Michelle over here, because one of them is gonna have a long line. But you might wanna wait until after the presentation.
Any other questions?
So I just want to ask, there's a lot of homeless people. How do they get access to transportation?
That's a good question. We're going to have a panelist who might be able to answer that question.
Yeah, because I don't know, because most of my people are housed when I travel train. I have travel trained people who go to centers like St. Mary's centers for they have homeless there. I think is North Oakland doing something for homeless people. So yeah, I have done something for actually West Oakland for homeless. So but they have to come to the center. I'm not going to do it in the street.
Okay.
And I do go to your house, but I stopped doing that because I got scared one time. I had a situation. So I said, I ain't going to my house no more. I was like, no, I'm good with that.
All right, thank you, Steve. So I'll just add, Shanita mentioned AC Transit, but we also do travel training out with LAFTA too, Livermore Alameda Valley Transportation Authority. We've been out there as well. And Shanita can do travel training out there if necessary and as appropriate. A lot of her focus is with AC Transit in the AC Transit area. Also, travel training you know, it's important. I know it's been a while since I've actually gone on a travel training with Shanita, and Tom used to do travel training too. And I didn't even know how to get a clipper card. Tommy showed me how to get a clipper card, and we took part from like Rockbridge all the way up to Brentwood. So it was quite, this was years ago. Now, Shanita didn't mention this, but I'm excited because I am going to go with her on a travel training on June the 14th. She didn't mention that one. You want to come up and tell people about the June 14th? I know it's all sold out, but let's come and tell them about it, Shanita. Yeah, because it's a limited travel training opportunity, and some of us signed up. I think she could only take like 30 people or something, but why don't you tell them about it? Because, they've gone travel, I think she's travel trained people to Sacramento and different places, but this is a special one on June 14th.
Well, I had started travel training people outside of the community to go to Sacramento and different things, and so Amtrak and Winter Consulting contacted me. Oh, I had also worked with the Realign project for AC Transit. So Amtrak and Winter Consulting contacted me to organize a trip to no, not China. I wish. To Allensworth. Colonel Allensworth is up near Bakersfield. And I thought it was like a 2-3 hour train ride. It's actually a 5-hour train ride. And I was like, what am I gonna do with all these seniors for 5 hours, So I'm hoping they'll sleep on the way back, but I think I have enough to keep them busy on the way going. But anyway, they granted us this for 30 seniors actually 25 seniors in the community, and I had to beg for extra tickets, and they went so fast. So everybody is going from USOAC, so we're excited about it. But you can still buy tickets. They have them for half off. I think they're 75% off. So they still have tickets where you can go, but you have to pay now. I didn't bring that information. You would have to call me at the office. Yeah, I didn't bring that information because it's already booked. It was like it only took 2 days and everybody snatched up every ticket. So.
You have any idea how much is the half off price?
I don't know, but I know it's real cheap. It's not more, I don't know, but I can find out. Do you know?
It's half price.
It's half, that's what I know, but I don't know what half price
Well,
is.
AC Transit is half price, so currently the base fare is $250, so the senior rate is $1.25.
No, he was talking about for Allensworth, right?
Oh.
Yeah, that's Director Murphy McCauley back there from AC Transit, y'all. He came in late because he thought it was somewhere else. But he's here now. So if y'all got some questions afterwards or some comments about AC Transit, we should have did this after August, after they implemented the Realign, so we would really have, because things are going so great right now. But once that Realign and all those changes, I know my phone is going to be ringing off the hook.
Thank you, Shanita. Murphy's the AC Transit Director for this area. So why don't you raise your hand, Murphy, so people can see you. Okay. All right, great. And I asked Shanita if she was doing travel training from Oakland to Sausalito, and she said she just does it from Oakland to San Francisco. Because I want her to do a ferry ride from Oakland to Sausalito. I told her if she does that one, I'll go on that travel training too. Yeah. Okay. So what I'd like to do is have our panelists come up. Julian from Older Adult Division with Behavioral Health. Phil from Healthcare for the Homeless, and maybe Phil might be able to answer that question about transit for the homeless. Michelle. Actually, no, Michelle is going to be represented here today. And Kim. Is Kim here? Yeah. Come on up. Everybody can take a seat. And these folks will introduce themselves, and each of them will have about 10 minutes to make their presentation, and then when the entire panel concludes, then we'll open up to question and answers. And just hit the button, and when it shows green, you're set to go. So we'll start at this end with, I think it's Phil, and we'll work our way down. Is it okay? Okay.
So I have a presentation. I just want to say how great it is to be here. And when I look around this room, what I see is community and friendship and strength and power and a lot of history of knowing how to do stuff. And I'm going to talk a little bit about how we want to do that for our homeless seniors too. So, let me introduce myself. Oh, see if I can get this to work. I used to work at St. Mary's Centre, which is a homeless senior program in Oakland. And it built a community of advocates and seniors who went everywhere to change everything and to make sure that people got the things they needed. So it's a very important part of my life. Oops. We have a technical problem.
Yes.
I think it's really important that we're seen. I think it's really important that we're seen as seniors. And if you're living on the street, or if you don't have a home, or if you don't have a family, it's still important to be seen. And that we then can move forward and get the services that we need. So, I can just jump in while you find it, is that okay? I think I called it the Eden. I think it's listed as Eden. That one. So, a little bit about healthcare for the homeless. My name is Phil Clark. I'm the Homeless Services Regional Coordinator for Mid-County, which is everywhere from Alameda all the way to Union City. My job is to work with community members and systems to ensure that folk who are homeless have a place at the table and have the services that they need. Let's go to the next one. So healthcare for the homeless, we've been around for 35 years. We're a federally qualified health clinic, and we work exclusively with folk who are homeless. We're also funded by HRSA, which also gives us the ability to work with folk who are couch surfing, folk who are unsheltered on the streets, living in encampments, or I'll talk quite a bit about encampments, people residing in shelters, recovery and transitional programs. Let's go to the next one. So what do? We coordinate a network of health centers and community-based programs. And our goal is to improve access to and improve the quality of that care for homeless folk in Alameda County, right across the county. We fund programs, we work very closely with our contractors and our community partners. Our hope is to strengthen services, to provide guidance, and then also, really importantly, to supply healthcare to folk where they're living. So what does that look like? We have a series of primary care clinics, homes. We have street health outreach teams, I'll talk about those. Shelter health teams. We have the Alameda Health System, a mobile van, which you may have seen parked around here, and then specialty care for dental and for optical. Next one. So this is too busy, but basically on the right-hand side it shows that over about 39% of the folk we work with are over 55. And if you look to the 45 to 54, there's another 23%. So the majority of the folk we work with are elderly. One of the things that we know about being homeless and being on the streets is that what we say is 50 is the new 70. If you're living on the streets and you're homeless, you'll have the same sort of health conditions you would normally expect to have at 70. Living on the streets ages you by 20 years. So this is from our clinics. This is the demographics for who we work with. And again, this is from our street health team. And this is even higher, 47% of the folk we work with are over 50. So we're working with seniors. Let's move forward. So we have a very close partnership with Alameda Health System. And this is where we supply our clinics. At the Highland Hospital, we have a dental clinic at Eastmont, Haywood Wellness, and then Newark. So we have a series of sites that are across the county where folk who are homeless can just literally walk in through the doors. Next one. In Oakland, we have a very strong partnership with Lifelong. We operate a full clinic on 14th Street, which is entirely for folk who are homeless. So people can come in off the street and get care there. Next one. So street health. So street health is, we have 14 teams across the county. In mid-county, we have 3 teams. Celestia Vasquez supplying care around here, and particularly in the corporate, you may have seen them in their vans. They tend to look like me. We always wear our purple outfits so we can stand out and be seen. And so the idea is to bring the care directly to where, can you get back on? So the idea is we want to bring the full service clinic directly to where someone's living. We want to address it, to focus on the patient's immediate needs. We're doctors, we're nurses, we're psychologists, we're case managers, and we're community members. We want to make sure that the safety is addressed immediately and that we are then focused directly on health. As we're doing that, what we want to do is link that person back to a clinic, and the case management staff are then linking that person through the coordinated entry system into housing. So we want to do 2 things. We want to make sure that people stay healthy and remain healthy, get connected to healthcare, and get connected to housing. So what we want to do is to remove barriers. We want to make sure that people get the care, what they need, when they need it. It's like your doctor coming to your home, coming to the streets, working with you and providing direct care. We want to make sure that people's health is stabilized and doesn't deteriorate. We want to make sure that where we can, we have people not going to the emergency clinics, emergency rooms, unless they have to. A lot of homeless folk just go straight to the ERs because that's the only access they have. We want to make sure that we have housing stability. We want to make sure that people are safe where they are and they can move into good housing. And then we also want to work on increasing benefits and income. Because we all know that what people need is they need a home, they need something to eat, and they need money. So next one. So the team, the street health team is a registered nurse. She runs the team. We have a community health outreach worker or a case manager. They're going to be working on the housing piece of it. We have a social worker who's going to be working on the more clinically complex issues. And then we have a part-time medical provider who's either a doctor, a psychiatrist, or a nurse practitioner. Next one. And so, the biggest thing that we need to establish is trust and rapport. We did a series of focus groups a couple of years ago, and what most of the folk who we talked to who were homeless said, they don't trust the system. They don't trust the people. They're judged. They don't feel welcome. So that's one of the main things we want to do. What we do health assessments, we diagnose, we work on immunization, and we do health education. We also do a lot of work around behavioral health, substance use and mental health. While we're doing all of that, we're trying to get people housed. We're getting into the coordinated entry system, doing housing problem solving, and we're navigating that person back home. And that's what I see in this room as a home. And that's what we're trying to do for our folk. Next one. We also have a very strong partnership. You may have seen the van here, that we work closely with Alameda System of Care. They have a mobile health van. It's huge. You know, see part in the neighborhood. It has a clinical team on board, again, a nurse practitioner, medical assistant, mobile health specialist, and a patient services representative. So, this is what we do on the trucks. We do alcohol treatment, benefits counselling, dental care. We do a lot of work. People want to have their teeth looked at, their eyes looked at. And then we try and engage people in food assistance, getting them ready into the shelter system if that's what they want. Legal assistance. Big part of the work we do is mental health. Primary care, it's like sitting with your doctor. She's going to diagnose you, she's going to prescribe, she's going to work with you. And then transportation assistance, and we can come back to that if you have a question. So then we also do health education. We did an enormous amount of work in the COVID pandemic, getting vaccinations and testing done. We do point-of-care testing for things like hepatitis, TB, HIV, hepatitis C, and we still take out COVID vaccines. So if you don't have a COVID vaccine right now, then I strongly encourage you to get the booster. So next one. So one of the things we've just developed, and it's brand new, is what we're calling medically frail housing. This is for folk, during the COVID pandemic, we identified a lot of individuals who had very complex medical needs. So our response to that was to develop what we're calling medically frail housing, and it's going to be in two pieces: permanent housing and shelters. We've also worked with the Continuum of Care, which is the body that organises homeless services, to ensure that the folk are then prioritised into those services. Next one. So is it designed for? It's designed for folk who have difficulties with their activities of daily living, their ADLs. Folk who need assistance with walking, feeding themselves, dressing, wound care, grooming, toileting, bathing, or transferring from one position to another. Or if they rely on devices like a walker or a wheelchair, or if they're bedbound. We often find in our encampments, we're going to a tent, there'll be somebody who's bedbound, who's been there for quite a long time. And then also for severe mental illness and traumatic brain injury. Next one. We have 3 tiers. The first one, which is always surprising to folk, is basically hospice. It's folk who are in palliative care or hospice, people who are in the end of their life and they need somewhere to experience the end of their life and to die with dignity. There's also a category in tier 1 which is about imminent or continuous risk of violence and danger, or if they're unable to access food, water, or life-saving treatment. Tier 2 is for folk who need DME and durable medical equipment, things like walkers, wheelchairs, or if they need dialysis. And then also access to toilets and hygiene. And the lowest level is for, well, I said the lowest level, this is all very high level care, is folk with multiple chronic conditions would benefit from ongoing medical care. So, and I'm saying a lot of stuff here, I know. Next one, please. So we're going to do that in 2 ways. One is interim housing, which basically means shelters. The second is permanent housing, and we're developing this as we speak. They're going to be site-based, so the services are going to be where the people are living. They're going to have nursing and personal care services on site, and you do not have to be a part of the HLIS system, which is the homeless management system to get in. So another big piece of our primary focus of the work we do is what we call harm reduction and then access to substance use and treatment. We do a lot of work around reversing overdoses, looking at safe injection and how to use Narcan. If you find someone who's overdosed, it's a way that will reverse that life-threatening situation. We get people into medically assisted treatment, we get people into substance use disorder treatment, and we've just got a state opiate settlement, which is also then expanding every year. Next one. So then we plan for the winter season. Every year we mobilize our teams to vaccinate people. The last 4 or 5 years it's been really heavily focused on COVID. Now we're moving back to looking at pop-ups for COVID boosters, but also for flu shots. And I also then coordinate a communicable diseases group that's the Department of Public Health and the shelter system talk together every month to look at what is happening in the shelters, what disease profiles are going through there, and how we can prevent them. The next one. Every month we do a training, which you're welcome to join. We have about 200 people come to the training. It's a virtual training. It covers issues around working with folk who are homeless and the health issues around them. And the last one is, that's me. The easiest way to reach me, I'm kind of old school, is to call me. Send me a text if you must. And one of the things that I can do, if you have concerns, is I can look behind the system of care and identify how I can mobilize the resources that we have. So that probably took longer than 10 minutes. So thank you.
Hi everybody, my name is Julian Schreck, and I'm the Director of Older Adult Services at Alameda County Behavioral Health Department. So So we're a part of Alameda County Health. And I'm here to tell you a little bit about what the Behavioral Health Department does, who we serve, some specific older adult programs that we fund, and some new ones that are on the horizon that will be built in the near future. All right, so first of all, what are we? Alameda County Behavioral Health Department is really made up of two systems. One's called the county's mental health plan. You can go to the next slide. Thank you. And the county's mental health plan, that means that we are responsible for providing mental health services to people who are on Medi-Cal or have no insurance, who have a serious mental illness, or if you're a child or youth, a serious emotional disturbance. And in the last few years, our who can get into services has expanded, especially on the children and youth side. Now, if a child has experienced trauma, significant trauma, that is expected to lead to a future mental illness, they also can come into our system and get services that way, which is a big advancement from where we were in the past. And then we have what's called the drug Medi-Cal organized delivery system. Simply put, a continuum of care for substance use treatment, from prevention services to outpatient treatment, to residential treatment, to withdrawal management and medical detox. And those two systems make up the Behavioral Health Department. Okay, and then in terms of who can get access to our services, we serve primarily people who have Medi-Cal or who have no insurance. We do serve a lot of people who have Medi-Cal and Medicare. You can go to the next slide, thanks. For adults, you have to have a serious mental illness. So that means basically your mental illness is impacting you in such a way that it's really limiting one part of your life. And then if you go to the next one, it's important to know that if you do have Medi-Cal or you have loved ones who have Medi-Cal, there's actually two types of mental health services that a person can be eligible for. So the Medi-Cal managed care plans, Alameda lines for most people in Alameda County. There's also Kaiser Medi-Cal. Those Medi-Cal managed care plans also offer mental health services. And they serve people who are identified as having a milder mental illness. And then the mental health plan, Alameda County Behavioral Health, serves those who are more severe. You can get access from either plan. So if you call Alameda Alliance or you call us, the Behavioral Health Plan, we'll get you to where you need to be, basically. Okay. Sorry, this one's a little boring here, but this is a snapshot of who we served in fiscal year 23-24. And 9% of our mental health clients are 60 years and above. It's very similar to what Phil said in terms of shortened lifespan. Somebody with serious mental illness for many different reasons is expected to have 20 to 25 years less on their lifespan than somebody without serious mental illness. We served around 26,000 people in our outpatient mental health services. So 9% comes about to a little bit more than 2,000 older adults that we serve. And then on the next slide, we're going to look at substance use programs. So our substance use system of care is much smaller. It was created many years after the mental health plan has, so it's still in its youth. It's not a baby, like it's not in infancy, but it's still on the way to full development, I would say. So we served about 5,000 people in our substance use system of care in fiscal year 23-24, and about 11% of those clients were 60 years or plus. So that equates to around 540 folks. And then, our substance use system of care is for all people on Medi-Cal. It doesn't matter how severe your substance use needs are. If you have any kind of substance use service needs and you have Medi-Cal or no insurance, then we are your service provider for substance use treatment. Okay, and then in terms of what do we actually offer, this next slide's got a lot on it. And it shows the different systems of care. So our adult and older adult system of care is for folks 18 and above. Child and young adult system of care is actually for people who in early childhood all the way through 24. So there's a little bit of overlap between adults and children and youth system. And then we have our substance use system of care, and one of our newer systems of care is our forensic system. So we do the mental health services inside Santa Rita Jail. We also do the mental health services for folks who are re-entering the community. And each system has a continuum of services from, light touch, maybe just outpatient therapy or outpatient meds, to intensive outpatient, to residential, to inpatient, to subacute, and to state hospital. There's a very large continuum within the mental health systems. We also have a large crisis service system. So we have mobile crisis in most cities within Alameda County. Some cities have their own mobile crisis vehicles and response teams. But mobile crisis and other crisis support services are available for people of all ages. And then we do a ton of care coordination within our system to make it work, and then outside of our system with all the other service agencies, housing, physical health, you name it, we try to be connected with them. And then we can run through some of our older adult specific programs, starting out with our least intensive going up to our most intensive. So we have what's called a geriatric assessment and response team that's county operated. And so that is a part of our crisis system. They can go out and assess an older adult, and they're very good at differentiating. Is this something that's due to a medical problem or a mental illness? Is it a neurological condition like dementia? Is it substance use? And kind of pull apart what's happening with the person to figure out what's the best treatment for them. The next level is some outpatient therapy supports, and this is specific for North County. So we fund many different community-based organizations or nonprofits in the community. So there's older adult therapy through crisis support services, and the Pacific Center offers therapy for older adults who identify as lesbian, gay, bisexual, transgender, questioning, plus. Okay, and then we can go on to the next slide. Phil mentioned St. Mary Center. We fund housing navigation through them for seniors 55 and plus. And that is an amazing program. They're very successful at supporting older adults get into transitional housing who are unhoused and into permanent supported housing. If I was a senior in Oakland, Emeryville, South Berkeley, I would go there if I needed help with housing for sure. Okay, the city of Fremont is rich in older adult programs, I gotta say. We fund 3 different programs with the city of Fremont. They also have great age-well centers or senior centers. So there's a senior mobile mental health program that does therapy and medications for older adults in their homes, who are usually homebound seniors who need mental health treatment. And then as people progress in their recovery and get better and more stable, they can move out of that kind of high-level program and back into a more socialization, peer-based program, where they can continue to access medication services, but also do more integrated activities in the community. And then the city of Fremont also has an LGBTQ plus peer coaching program as well. Okay, so now we're getting more into the intensive programs that we fund and offer. Felton Institute is a nonprofit that runs our older adult service team, and this is more of an intensive case management team. So there's nurses, doctors, social workers, peers, community-based. They serve about 90 folks in the community, and these are folks who typically are going in and out of John George or other psychiatric units. So they need a high level of service to maintain their wellness in the community. And then the highest level of outpatient care that we have is called a full service partnership. And that is, you can kind of think of it as a hospital without walls. So they are 24/7 available. They also have housing funding, so they can get somebody off the street into housing very easily, much easier than our other programs can. And they work on the weekends, they're available at night, and they have a small staffing ratio. So So our other programs are maybe like one staff or 20 to 30 clients. Our full service partnerships is one staff to 10 clients. So they can be seen every day of the week out in the community if they need to be. And then we do have a subacute facility. It's actually a skilled nursing facility not far from here, in Hayward, and it's a skilled nursing facility with a special treatment program, which means that they're authorized to serve folks with serious mental illness. It is a locked facility. People who are typically conserved are able to go there, and we have 78 beds within that facility that are almost always full. There's almost always a significant wait list to get into Morton Baker Center, and they do amazing work, gotta say. Okay. So on our substance use side of the house, we have two programs that are specific for older adults, and they're more in the realm of substance use prevention services. You know, statistics around substance use, alcohol, prescription drugs, other drugs. There's a lot of evidence, you know, since COVID that those rates of use have significantly increased, especially in older adults and especially in older adult women. And I know there's a lot of stigma around reaching out for help around substance use, but we all probably know somebody who needs some support in that area, and sometimes we need it ourselves. So really encourage you to, if you need help or if you know somebody needs help, feel free to reach out to talk about how to access those services. And then in terms of how to do that, we have two phone numbers. We have a phone number for our mental health access line, which is the 1-800-491-9099. And we also have some flyers on the back with all this info in it as well. We have a separate phone number for our substance use treatment services, the 1-844-682-7215. Right now, there's two different groups of people. There's one group who does the mental health access and a different group who does the substance use access. In the next year or two, it'll be one group doing both, and there will only be one phone number, which will be great for making it easier for folks to get into services. Okay, and I got about 2 more slides. So this is hot off the press. A lot of the people within the behavioral health department don't know about this yet, so you guys are one of the first groups to hear. But we were recently awarded funds from the state to create a new geriatric psychiatry unit. We were actually awarded funds to build many new programs throughout the community in Alameda County. This one is specific to older adults. And this funding came from what's called the Behavioral Health Infrastructure Program. So it's actually for the building, like the construction of these buildings, which is something our mental health system has needed since it was created. So it's a great step in the right direction. If you go to the next slide, here's some more of the details about the new geriatric psych unit. So it'll be for people who are 55 plus, who need acute inpatient psychiatric care. So that means locks, like John George level of care. It also will allow people who have dementia-related behavioral disturbances, which is a technical way of saying are acting out because of dementia in ways that they need to be supported in a enclosed environment. So this doesn't exist anywhere right now in Alameda County. So what exactly is it? It's like a medical unit of a hospital. So it has all the things that a normal medical hospital will have, and it has everything that a locked psych unit will have, and it'll be integrated in one place. It'll be at St. Rose Hospital in Hayward. It'll be 20 beds. So, and you know, what's going to be happening is they're going to renovate a part of St. Rose and turn it into this new facility. So that's going to take some time. It's expected to open in early 2029 at this point. All of these are very preliminary plans, so as things develop, they might change, but this is the plan as of right now. And I think that comes to a close. So this is my information. That's my cell phone number. That's my email address. Call, text, email. I'm always happy to consult if you're yourself or you know an older adult who's not getting the mental health or the substance use treatment that you need, I'm always happy to talk and figure out how to navigate these systems and really working hard to make sure that we create easier systems to navigate as we move forward. So it's a pleasure to be here today, and I really appreciate the opportunity to share this information with you. Thank you.
That telephone number, he had two numbers for the ACBHD.
Yeah,
That second number I wasn't able to get.
I'll get you a flyer.
Thank you.
Good afternoon, everybody.
After.
My name is Dylan Sweeney. I'm the Programs and Policy Manager for the Alameda County Department of Housing and Community Development. Apologies on behalf of Michelle to be here today. I realized I didn't put in a slide about what your Housing and Community Development Department is, so just a little bit off the cuff. So we're a little different from some of the other folks who are speaking here. We don't directly provide services generally. We're a small but mighty team of about 35 folks. And our job is that when our Board of Supervisors or our voters or the state or the federal government finds money that they identify they want to use to provide housing programs or invest in housing, we're the team at the county level that puts that money to work for you. We design those programs with our partners, we set them up, and we get them out in the communities that they're available. And mostly we support the development of affordable housing. So as you know, I think we unfortunately started most of our presentations with this slide, that the high and rising costs of housing in our county are creating a lot of problems for folks in our community, especially those with lower incomes and those who, unfortunately lose their homes. Next slide. And so, unfortunately, what we're seeing is that, we're going to slide 3. Thanks. What we've been seeing in the past decade is that seniors are especially vulnerable to these issues, and we're seeing that even homeowners who are seniors are under a lot of housing cost pressure that we hadn't been seeing before, basically in the history of the county. So at the most extreme end, we see this in our biannual homelessness counts, where seniors are unfortunately the fastest growing demographic of those living without shelter. But we also see this as just one sort of indicator of a broader problem that's impacting the community of those living on fixed incomes, living with set mortgages and set costs. So at HCD we pay a lot of attention to making sure that our programs are accessible and targeted to the needs of our senior residents, because we see that they're not being served as well as they could be. So our biggest program that we have been managing for the past 8 years is administering the Measure A1 bond funds that were approved in 2016. So that identified $580 million. And it's been the critical source for the production of new affordable housing in Alameda County over the last 9-10 years. We're proud we came in producing more housing units than our initial goal of 4,170 new units. And of those new units, about 1,200 are affordable to those at or below 20% AMI. So those are units, frankly, that can support the rehousing of folks living without shelter, or folks who are on really small fixed incomes like SSDI. In addition to those units, we were able to build almost 600 that are set aside specifically for seniors and for medical frail individuals, as we mentioned earlier. So we're very proud of our success we've had in putting this money to work for you. And unfortunately, we fully allocated all of those funds now. And so, without a new or a continuing source of revenue, this rate of new affordable housing production is going to start to slow down until we can find additional funds. But in the meantime, we are still managing a lot of additional programs that are still available in our community. So a big one that I think is really relevant here is our new AC program. And so this is a program that helps folks who may not have the funds or the credit to repair their homes, who own their homes, to stay in their homes and get those repairs made. And that's made in the form of a loan. But that loan is deferred interest, and it's basically paid back at the point of sale. So we've had a lot of success with this program, supporting folks who just want to stay in place, who want to maintain ownership of their property, who don't want to or don't need to relocate, who just can't maintain that habitability. And this is a program that you can access right now if you go Stephanie back here, she can tell you how. The next program that we'd like to highlight is Alameda County Housing Secure. So this is a program that's also available countywide. It's a website, it's a hotline, and it's basically a one-stop shop where you can call if you're having issues where you're worried about losing your home. So this is for folks who rent, but also for folks who own their home. Maybe you're facing eviction, maybe you're facing foreclosure. They'll help work through that initially with you. And so there are a lot of different solutions because we know there's a lot of different types of problems that can be causing that. They can help direct you in the appropriate direction and potentially provide legal services around, dealing with that eviction or that foreclosure. Our next program is a newer one that we just set up. I'm not sure if anyone here is providing rental housing themselves, but we're working in partnership with our housing providers as well, so that we can just coordinate more closely around the deployment of our programs, which serve tenants, right? Tenants can't access our programs if they don't know about it. Every tenant has a housing provider, so they're a great partner in providing those services. Likewise, we know a lot of folks who are maybe renting out their house, they're also dependent on that income. So we want to protect that asset, we want to protect that situation. Maybe we want to provide them with resources they need to make repairs, or just with better access to one of the many county programs that can help them. That could be, providing vector control for rodents. It could be accessing things like a tax exemption to provide lower cost housing. So we just rolled this out last year, and we're really excited about building on this partnership so we can move that forward. Another new program that we set up in the last year with federal funds is a mediation program that's available now for folks in unincorporated county. And so we know a lot of disputes between landlords and tenants can get pretty acrimonious pretty fast. They can lead to litigation that can be really costly for tenants, landlords, and the county, and it's probably not going to produce the best solution. So we wanted to make mediation available to folks so that they could do it at zero cost. Mediation isn't free, but it is now free for tenants and landlords who are having those issues. They can call us up. The Housing Provider Resource Center we talked about earlier is helping to make sure everyone's aware of this, and then hopefully keep people housed, keep people from getting evictions on their record, make sure that people don't waste money, get overly viewed. Another program that is now sort of fully stood up is we have been a real leader in Alameda County, in the Bay Area generally, making our affordable housing, that we mentioned earlier, searchable and available, right? In the past, it was really difficult to figure out what housing units were available, what was up for lease, what wasn't. And then what we were able to do was set up a single stop, right? We call it Doorway. They have a phone number too, but primarily it's a website. And in that website, we're listing all the affordable housing units that get built and become available in the county. And the good news is we have recently integrated with the regional portal. So we know we all prefer to live and stay in the communities that we're in. But now it means that you can search not just within Alameda County, but throughout the whole Bay Area, so that way you're not limited to just the solutions that we have here. So this is really nice because it can save you a lot of headache in terms of figuring out if you're eligible, what sort of meets your needs, what meets your income level. You can kind of very easily click through that. And then, unfortunately, there's a lot more people who need this resource than is available. But every time, in the past, you had to go check for housing, you have to reapply every time. And that's a significant amount of time for folks whose time is valuable, right? Sometimes they have to go to a specific office, they have to drop off paperwork. Now you just put in one application, it stays on the system, you can just peek in and move things are open, you can just click a button and enter the next login. So we think we save folks a lot of time, and we're really proud about that. In the future, hopefully we'll be able to expand on it a bit more. But our big next task is happening right now, and so we have been asked to come up with a plan to really start to address some of the root causes of this high housing costs, a lot of the problems and the ways that it's impacting our community, and essentially ask how are we going to find solutions and how would we prioritize resources to address these needs. So over the last 20 months, we started at the community level. I think I was here, I guess that's 2 years ago almost, in the same room. Michelle was beginning that community input process to make sure that this document reflected the priorities and needs of the community. We're building on the work done with folks over at the health department related to the homelessness response plan, Home Together 2026, folks related to our justice system, to our foster care system, to sort of integrate all of those and look forward about what we can do over the next 10 years to began this process, I think, by managing our Measure A1 funds back in 2016 and really building a lot of new affordable units. We learned a lot too about what it takes to build those units. Now, go to the next slide. Now we have a draft document about what we're hoping to do in the next 10 years and how we can potentially get there. Kind of impacts that we could see, we would like to see, and frankly, that are realistic given certain amounts of resources, right? We don't want to just make promises. We want to provide people with a realistic appraisal of what can happen and what we would like to happen. So, Stephanie's there. In the back, we can let you know about how to access this draft plan on the website. We are going to be taking the final version of this plan to the Board of Supervisors, I believe, in July. And, after that, it's off to the races and get back to work on coming up with new ideas and implementing the plan. So, just a brief explanation of what's contained in the plan. We break all of our services down into these three rough categories. One is producing new housing. That's producing new housing that's affordable to folks, that is housing people who are currently living without shelter, that's specifically for seniors, but it's also just producing more housing in Alameda County. We have goals about how much housing we will need to produce to take ourselves out of this cost issue, and we're interested in engaging with that whole spectrum of production. The second is preservation. A lot of people are in apartments right now that they're paying below market rate, and that's a stable situation. If we can keep those people in those homes, we can avoid them having to go back out on the housing market and seeing their housing costs increase when they get a new market rate. The second piece of that is, there's preserving that tenancy arrangement, but also preserving that building, right? Because unfortunately, costs for everything are going up. So if your tenants are paying below market rate, you may not have enough money to properly maintain your building. And that's true for small landlords. That's also true for our affordable housing providers. They also have old buildings that provide affordable housing that have deferred maintenance, that are seeing costs increase faster than revenues. So preservation is a huge piece. We can't be moving backwards and moving forwards at the same time. And then the third one is protect. So a lot of folks who are living in unstable situations, who are living on fixed incomes, who are living in apartments that they're paying lower rent than the market can really justify. Those folks are vulnerable to all sorts of different issues. They could be vulnerable to, missing a little bit of income and therefore losing access to their rent. They could be vulnerable to, frankly, bad practices on behalf of landlords who know that they can be making more money from it, from their unit. And they could be vulnerable to just displacement from, large-scale development of buildings, gentrification that we all have been talking about for a decade now, unfortunately. And so we operate programs like AC Housing Secure that are designed to address that, right? Maybe it's providing a small amount of, cash assistance, one-time cash assistance. Maybe it's linking them to job training programs so they can, make sure they improve their income. But that protection piece is a big key component as well, and that is another area that we're hoping to really innovate on and build in and leverage our partnerships with folks who can help people in need. So I know Q&A is afterwards, but that's all I've got. And I'll also leave my cards and be with Stephanie in the back. Unfortunately, I forgot my contact information.
It's not a question, I just wonder, good presentation, and what we can certainly the most of the current situation, things going like that. And then I just wonder about what you're thinking possibility, which is, could be I don't know, I just feel like if positively always provide food and then some people cheaters, but they don't have a work to offer to them. Some people I know they put the program, but they don't have people to accept them. They bankrupt. They don't have anything. People cannot money. So I wonder if we can combine with some skill training part with the homeless on the street or people have no income, and then make them have a job to do. They can be proud of themselves. Also, they can produce for the society, reduce people not feeling the money as well. So I just wonder, find a job for them also. Start with a simple job, and then just put the thing on a different place, on the stage, or whatever thing from that. Also make them feel like they're valuable. They're not just like begging the money or begging the food from the government. Make people, even they feel that they embarrassing sometimes.
We operate a program like that. I'd love to talk with you about it, but I want to make sure that others.
Yeah, I can't finish.
But we'll be talking a little bit about something like that as well.
Yeah, I'm sorry, I'm just, what are you thinking?
Okay, so we have it here.
Hi, I'm Kim Fogel. I'm a management analyst with the Alameda County Area Agency on Aging. And a part of what we do is we offer many services, and someone came up to me and said, well, I'm not in a crisis right now, but the over 70,000 people who receive Area Agency on Aging services every year are not all in crisis because of the wide variety of services we offer. In this photo, it looks like the stock photo of 49-year-old models, but this is actually at the East Oakland Senior Center at last year's Older Americans Month celebration for nonagenarians and centenarians. If I look half that fabulous next year, I will be pleased. So that is, part of the wide variety of people that we have the pleasure of encountering in our work. Next slide, please. Who are the older adults of Alameda County? Artists. This is Q Wong. I apologize in advance that I am probably mispronouncing his name, but he won an older adult art competition in 2023, giving us a fabulous cover for our four-year area plan, which I'll talk more about later. Community leaders, we have Supervisor Miley at last year's Healthy Living Festival. As you can see, they are a lot of fun. And in this case, besides showing that Alameda County is probably the coolest in the nation, he's helping demonstrate the importance of movement and exercise. Entertainers, the lovely Mr. Keith Barrows sang his Rat Pack tunes at a couple of our events last year. And finally, lion tamers. This was at the Vietnamese, the VACCEB, the Vietnamese Association's Lunar New Year Festival last year. And what we also had a chance to see was how they are able to put together culturally appropriate meals for the community. Next slide. Yes, these are just a few of the kinds of people. Area Agency on Aging, biggest question we get asked is who are you and what do you do? This is a problem for what we call AAAs all across the country, and besides being wounding to our fragile egos, it means that people are often not aware of the services that we can provide for them. So just a quick Area Agency on Aging 101. They were established under the Older Americans Act of 1965. At the time that bill was signed into law, older adults in America were not doing well. Widespread poverty and too many people in institutions who really didn't have to be there if they had some community support. Now, this has been reauthorized. It was reauthorized last December. Of course, the the $64,000 question is, how will the services be funded going forward, is what we're all waiting to see. Area Agencies on Aging were added to the Older Americans Act in 1973, and what we are on-the-ground organizations charged with helping vulnerable older adults live with independence and dignity in their homes and communities, least restrictive possible setting. Our state authority is the California Department of Aging. The Older Californians Act of 1980 redefined the duties and functions of the OCDA. We should have spelled that out, California Department of Aging. The state of California has a total of 33 AAAs. I'll have to put a quarter in the jar because we set up an acronym jar, and if you use an acronym without explaining it first, you have to put a quarter in, kind of like a swear jar. Next slide. So, the finances of it all. Where does the money come from? Where does it go? I won't spend too much time because I'm probably going to go over, but most of it is federal funds. The rest is state, a little bit from the county, and sometimes one-time only funds such as what we received during COVID. However, the federal funds go to the state, and the state is really in charge of the allocation. Next slide, please. So where does it go? Vast majority goes to the meal programs, congregate and mainly home delivered. And when we see that as part of the housing issue and homelessness issue, is so people don't have to choose as much between their food and rent. It can help take some of that financial burden off of the seniors. And even some of these where you're seeing smaller percentages, they have a big impact. Senior centers, that's about 3% of what we fund, but we know from what you've told us at almost all the events we've attended or held, that is a huge lifeline for most of us. And then the elder abuse education, we have a separate department of adult protective services, but we help educate the public to recognize the signs and prevent it. So those, and the ombudsman program, 8%, but for those who do need assisted living, be it assisted living or skilled nursing, it helps give people, families and residents a place to go if they need some help dealing with their facility. Okay, so next slide. So just as a snapshot, our services are countywide, every community, every district. Over 600,000 home delivered meals, approximately 200,000 congregate, approximately 27,000 nutrition education participants, and like I said, over 73,000 unduplicated clients are served by AAA program every year. Next slide. Fast forward my time. Okay, so just a quick, this is where we sit. Of course, these county board of supervisors. We are in the social services agency in the adult and aging department. So we answer to the adult and aging, area agency on aging director is Jennifer Stevens-Pierre. Faith Battles is the director of adult and aging services. Andrea Ford is the director of social services. And then, of course, the board of supervisors. And then we also, all AAAs have to have an advisory commission on aging. And many of our key documents, such as the area plan and the area plan update, the board won't even look at it till the advisory commission signs off. We'll talk a little more about that later because we need some help. Go ahead. And that was just some of the here's a little more. Our impact is wide ranging. Give it another clip. Yeah, I like animations and stuff. I get a little carried away. For some reason my words aren't all fitting there, but just home delivered meals, case management, family caregivers, senior injury prevention, fall prevention classes, the meals, some of the organizations that have been mentioned previously, such as St. Mary's, and the senior centers. We help fund many of those activities by contracting with the organizations that provide them, or in some cases providing direct services ourselves. Next slide. Here's just an example of the real human impact in the community. Give it one more clip for me. Stitch-in times. This is 74-year-old Estelle. She can't grocery shop for herself or fix meals, but she receives healthy meals and a kind word every week from SOS Meals on Wheels, and many of you may have heard of in San Leandro. And they are a key nutrition program. They're supported by the AAA with funding from Older American Act dollars. And what she does in return is she crochets warm scarves for the volunteers and others. And this is just one example of how AAA, dedicated staff and volunteers at the Meals on Wheels program, public generosity that also helps support that organization, And that way, older adults like Estelle do not have to be prematurely institutionalized despite, having some disabilities. And they are still giving, our seniors give back to the community. Next slide. Okay, what are we doing now? And I think somebody else had that same stock photo, my apologies. So, thanks to the Alameda County Board of Supervisors, the help of everyone in SSA, and especially social services, and especially adult and aging, our advisory commission on aging, and you, our fabulous community, thank you. The 2024-2028 countywide area plan for older adults has been completed and approved by the state. The area plan is not, or CWAP as we call it for short, it's not just a good idea, it's the law. Every area agency on aging has to produce one to plan services for older adults every 4 years. And we submit it to the state, and which has to approve it. And that is how we plan for these various services. And it's the result of a lot of community participation. Thank you everyone who completed the survey. I know it was a little long, and everyone who came to our focus groups, our public forums, and our public hearings. Thank you. And we will now we have to get to work because we have to launch our competitive bidding process for all the contracted services. What we also do that many people may not realize is we have to do reporting. We have to show, we can't just tell the state of California, oh, we're doing all these wonderful things. Our contractors have to submit monthly data to us. We must provide it to the California Department of Aging. I have a few emails in my box reminding me that we owe them some, so I'll try to get on that after this. And then also monitoring. We have to monitor and oversee our contractors to ensure compliance with their contracts and with the state and federal rules. One big example, of course, being, any place that's serving food, we need to make sure that, all the regulations and the dietary requirements are being followed for the benefit of the residents. Next slide. Okay, so is the countywide area plan just a report that sits on a shelf, or does it have results? Let's take a look at what people are celebrating. As you can see, there's some really happy people celebrating something here, and click one more time, we'll talk about that. One of our area plan goals is to deliver more coordinated and effective aging services through new and improved partnerships with other county departments, healthcare organizations, many of you, the cities that are coming up with age-friendly plans, and the Age-Friendly Council, which is a consortium of Alameda County departments and also organizations and residents. And let's see what we did. Here's one of the results. 3 graduating classes and counting in the Healthcare Career Pathway Certified Nursing Assistant Training Program. What new certified nursing assistants are doing is they're helping alleviate the staffing shortage in the county skilled nursing facilities. That is a nationwide problem, and especially in the state of California. And the AAA partner, we partner with our Workforce Development Board, San Leandro Adult School, and 2 nonprofits, Empowering Aging and Rubicon. And we have earned state and national recognition, most recently an award for US Aging. And some of the many of the students are people with real barriers. Maybe they financially could not afford training. There was one graduate who addressed the rest of the class, was someone who had been justice involved, and in fact had been very severely wounded by gunshots. And he decided he needed to get his life together. He was by then a father, and he wants to make something of himself. And he completed the program, and I hope if I ever need, skilled nursing care, he will be taking care of me. He was just wonderful. Okay, what's next? Well, it takes a community. How are we doing? Well, you have the floor. June 6th, we have a couple of events coming up. June 6th, at the public hearing for the area plan update, that's 2 p.m. at the San Leandro Library. You can take a flyer, watch our website for updates, but we've got flyers for both the events I'm going to tell you about over there at the Adult and Aging Services, so be sure to take them with you. June 16th at the San Leandro Community Center, Community Senior Center. We're having what's called a Scam Jam, which is how to avoid the very sophisticated methods now that people are targeting older adults. I've clicked a few wrong links myself. They are getting good. So, but we can fight back, and that's what this event will be about. And please spread the word about our services. One thing I just hear all the time and don't want to hear again is, boy, this service really helped me, but if only I'd known about it sooner, it would have saved myself and my family a lot of needless suffering. For example, if I'd known, someone just said the other day, if I had known that there was help for family caregivers, that would have really made a difference to me sooner. And that, that's one of the main reasons that we are really trying to make people more aware of what we're offering. Did you know you can get help navigating services for yourself or someone you care about through the Aging and Disability Resource Connection, which is a website, and the whole concept is no wrong door. You should be able to have one stop, not be called and transferred around when you need services for yourself or a loved one. And our senior information and assistance line, see that lovely lady over there in the pink and white shirt? Janine, wave to everybody. You call her, and then usually this lady answers, and she's a one woman, one stop shop to help refer you to the right place. And get involved. Also we have a senior update newsletter. We've got some over there. Let us know if you want to subscribe or need, I guess I needed to finish that sentence, hard copies. I don't know what happened to my hard copies, I'll fix that. And organizations, we have a listserv. If you want to be kept up to date, we have a monthly roundtable. So if you're part of an organization and you want to be part of monthly discussions of what the other organizations are doing, sign up for that. The Advisory Commission on Aging has a lot of openings. They say when you're a hammer, everything looks like a nail. Well, I'm a management analyst in the Area Agency on Aging, and everybody looks like a commissioner to me. I see lovely people. I forgot to bring my recruitment flyer for that, but I can certainly give you the link to apply. We've got a lot of openings. And then just leaving you with just another example of how we roll. So you can, of course, everyone knows who Supervisor Miley is. That's along with our area agency and agency director and one of our commissioners and a couple of our service providers. Last December, we all worked together to deliver holiday baskets to 50 homebound senior and disabled county residents. And those trucks were funded by the AAA under the Federal Nutrition Infrastructure Program. And the reason that's important, of course, is because if people are heavily reliant on home delivered meals, of course, the vehicles have to work and they have to be properly refrigerated and they have to be reliable. So they're going to help keep those food programs rolling for many years to come. And please contact AAA at acgov.org. I don't know why I just did that. I've got to work on some of my presentation skills. But AAA at acgov.org. We hope to hear from all of you, and thank you so much.
All right. So I want to thank the panel. Apologize for things running a little lengthy. I'm going to have least 3 of my staff to start preparing the lunch, which 3 of you can work on that. You work whatever washing you need to do and start getting the lunch ready. And while they're doing that, we're going to open up a question from the audience to the panel. Is somebody, Tom, you want to take the mic to folks? Because we don't need the slides anymore. And then also, if you want the slides, let us know. We can send you the slides as well. So we can make the slide presentation available to everyone. Also in the audience, we have folks from Alameda County Community Development Agency, the Healthy Homes Department, and they have brochures on Fix Your Home. And that Reggie Rubin's right there. He's got brochures on Fix Your Home as well. So I want to make sure people know about that. Okay, so while they're getting lunch ready, let's see what questions we have for folks. Who has a question? Wait a minute. There were 2 questions that were asked earlier. One was on transportation, around transportation for homeless. So you want to answer that?
Sure. Can you hear me? Yeah. So on our street health teams, the case manager or the community health manager can help with that.
He's talking right here.
I think you can hold it closer.
Yeah.
I can't hear very well. So, okay. So on our street health outreach teams, the case manager and the community health outreach worker can help with that. And I think the powers in this room too, and those trainings which are excellent on transport happen at St. Mary's. There's a great shelter just down the street from here at First Presbyterian. Perhaps we could get those trainings over there as well. So that's something we could look at. I believe my card's here. If you want me to follow up, I can do.
Thank you.
And then I think there was a question of Dylan earlier as well.
Yes, and so I think the question was around job training, essentially, for folks living without shelter. So we do support a couple of programs that provide that. So Downtown Streets Team, I know, is a big one that works to engage folks in community cleanup efforts and provide that as a kind of a resume builder and job skills builder that can provide a pathway to employment. I think in generally we're very interested in embedding career and economic development services into the housing living fund and into the, requiring it or enabling it into the structures that we're building. So we're working on it, but it's a great idea.
Okay. Who has a question? Tanya. You ready, Mike, here?
Yes, I had a question. You mentioned 1% interest loans. Are there funds available?
Yes, sir. Oh, wow. Yes, sir. So the Renew AC program is funded. It's active right now. So those funds are available. It's up to $200,000. The scope in terms of what we can support, is based around habitability and stuff. So you're not going to get a gold-plated countertop necessarily, but I'll help you fix your roof, grade your driveway, make sure your snow works, make sure everything's safe and up to code.
You don't have any grants
Okay,
available?
another question.
Any grants available? I understand you're talking about loans, but I'm concerned about the grants.
So no, ma'am. The reason for that, we'd love to have grants available, but the funds that we use come from a general obligation bond, right, property tax, and we're required to provide those funds through loans. And so the way we do it is it's just paid back at the point of sale. It collects simple interest, and so it's as good a deal as we can legally provide, and it shouldn't provide any or create any additional financial burden for anyone who takes on the loan.
Okay,
Me.
next question.
My question is for both housing and mental health, and it's a two-parter. Do you have options for rehabilitation? That's my first question. And my second question is, what kind of cancer treatment do you offer the people? Is there cancer treatments and option for rehab? So those are my questions.
Hi, this is Julie from Behavioral Health. When you say rehab, Do you mean like rehabilitating from having a mental illness or substance use problem?
Yeah, like the 28-day program, you know,
Uh-huh.
that they're not.
Yeah.
The 28-day program type thing, you know, inpatient, where they can actually get better, because I know that when you guys pick them up from the mall, you take them to John George and then you hold them and then they're back at the mall again. And I'm like, didn't I just?
Okay, let's
Yeah.
get the question answered.
Yeah, there's definitely a recidivism issue. We have a variety of programs. I think our entire system is really focused on recovery. So the belief that all people can recover from a mental illness. It doesn't mean that the mental illness goes away, but it means you can still have a fulfilling life in the community as a participating community member. So it's something that's a core of all of our services. There's outpatient, residential, inpatient, in both the mental health and the substance use side.
And then there was a second question too.
The question on cancer care, we operate a series of respite programs, which are 45 days to 90 days, or an extension to 6 months if needed. And a lot of the folk that come into our respite programs are coming up on the street are folk living with cancer. And so we offer those services, including full treatment. It's a fraction of the space that we need, but those services are there.
Okay, next question.
Not really a question, but just I wanted to piggyback on the question, or there was a question about grants for home repairs. So I'm Ruben, I'm with Alameda County Healthy Homes Department. We have a minor home repair program. Those are grants. So just to distinguish from the program that Dylan was talking about, Renew AC is great for major repairs such as roofs. We do smaller repairs such as leaky faucets, electrical work, water heaters, and those are grants. And that's the brochure that I have there, and I'm happy to hand them out to anyone that's interested in hearing more about it. Thanks.
So here's a brochure. Somebody else want to think of? Next question. Anybody else have a question?
I do.
Let's see, who's
I'm right
that?
here.
Oh, yes.
So I think this is gonna be for Phil, but, you know, like on the homeless situation, I think a major component of health is just being sanitary or, so do you have like a shower, like a mobile shower, group, or how do people out on the street, you know, kind of get, the ability to clean themselves, because that's gonna lead to greater health, you know?
It's a huge issue, that and access to bathrooms too. So there's a series of trucks that go around that have showers and washing machines in them. They're at First Presbyterian Church, and they're also at April Showers, which is the Boys and Girls Club in San Leandro. That's once a month, which isn't enough. And then the shelters often will have those the showers available. And then access to bathrooms and toilets are critical. And I would just encourage us all to advocate for the use of porta potties around at the encampments. People take care of themselves by using buckets and all sorts of stuff. And then we get a lot of complaints from the neighbours saying they're using buckets. And so it's a catch-22. But we certainly need more of those services.
Okay, you have a question?
Yeah, I think you can hear me. Yeah, so to access these programs, you know, like the First Presbyterian Church and the portable bathrooms and showers and washers and dryers, what's the intake process? Would we just call you, or would you call the church? If I'm taking a call, how would I connect that person?
Connect them to Sondrea. I'll take it up a level. They have a phone number which you can dial to call in. They have drop-in on Tuesdays and Thursdays between 2 and 4, and that's a place where people can come in. Then they have a day centre called the Recovery Cafe, which is open during the day, and people can go there. You can also call me and I can connect you to Sondrea, who's the director there.
Okay, I think there's a question here.
This is for AAA. I noticed that part of your budget went to day programs, and and yet I don't think we have conflict left in PACE programs, so I'm wondering if there's any opportunity to.
Well, as you know, one of our major adult daycare centers closed, unfortunately. We will, of course, as I said, we're going to be putting our contracts out to bid, so we do know that that is a huge loss to the community. Hopefully we can, restore it.
Okay, so we'll have one or two more questions, then I'm going to tell you about lunch. Right.
In the media, I hear a lot of talk about the current administration wants to cut back on certain programs that help seniors and that. One of the things I've heard about was they want to cut Meals on Wheels. What is the status of that situation?
Well, that part about getting involved. Does everyone here know who your representatives are? If not, we can help you look that up. The good news is that Medicare, Medicaid, Meals on Wheels are not controversial issues. You can safely bring them up at your Thanksgiving dinner table. Most people are for them. So it's really the way, part of our job. Now, we're nonpartisan. We don't call any of our leaders lizard people, no matter what we may personally think. But we do, part of our job is to advocate for legislation that benefits older adults. And the more involved you can get, just raising awareness. This is one case of our polarized society. You don't have to change a lot of minds because those people are with you. They just need to be aware of what's happening and what needs to be done.
All right, so last question.
Number one, thank you, Nate, for having the town hall meeting. Frankly, I am a bit disappointed that there are not more attendees because you're providing the opportunity for us to express our concerns. So thank you for providing that. Secondly, thank you for all of you panelists. I am surprised at the information that I did not know that you have had an opportunity to express. And I just wish there were more people that had a chance to hear what you had to share. So thank you for taking your time to do that. My question is, I am really concerned about this current administration and the federal impact that it's going to have on all of the services for older adults. So if anyone wants to speak about that, I'd appreciate it.
I think
This is the last question.
Today is a very good day to call your representatives, is my understanding, around potential Medi-Cal, which is California's Medicaid, and Medicare. I understand they're voting today on the budget reconciliation, and so, and there's other places, we know that a lot of our representatives are against it, but there are other ways you can advocate for it by doing phone banking, where you call people in other districts whose representatives might vote yes on it, and have urged them to call their representatives. So there is a lot of advocacy. If you're interested in it and you have access to a computer or cell phone that has internet, I would look up Justice in Aging. And they have a lot of advocacy around it that you can join in on.
Yes, okay, I just wanted to ask, do you all know of any grants for building a ramp for wheelchairs or walkers?
I really need that. I need a
Grants for building the ramp.
We do ramps, but it depends. If it goes over $3,000, we might not be able to do it. But you can call us and we can work with you to see if we can make that ramp happen.
Hallelujah.
All right, so let's thank the panelists. For lunch, I ordered enough lunch for 100 people, so there are about 50 of us here, so there'll be plenty of food. My staff will serve you the food. You can either eat it here or take it with you, and so and there's lunch for everybody. So why don't we start with you folks here? Get in line and get your lunch. These folks here. One thing to keep in mind, we will have our convention on June 13th. At the convention on June 13th, we will be covering some of these same topics again. Mental health, housing, homelessness. So you'll have an opportunity, as well as others, to get more information. We'll also be talking about public safety, disaster preparedness, travel training, and other things at the convention on June 13th.
Oh, I'm not gonna miss it.
We have water over here. Now I understand this lunch isn't that very nutritious. We got chicken sandwiches, potato salad, baked beans, and water. I guess the only nutritious thing we have is the water. If you want to blame somebody, blame me, because I'm the one who ordered the food. A lot of times the seniors tell me they don't want nothing nutritious. They want some good barbecue. So that's what I ordered, some good barbecue. Yes. All right, so we can have the other side get in line for the food too, and then we'll have the exhibitors. And I don't want to have to take any food out of here with me, so get yourself a good, healthy plate of food. And the food is from Roderick's. Roderick has a restaurant in Oakland near Bishop O'Dowd. Roderick's Barbecue. He has a restaurant in Oakland on 98th Avenue across from Bishop O'Dowd. That's where this good food came from. All right, the exhibitors, if you want lunch, come on, get in line. Get yourself some lunch. I don't want anyone to walk away from here and say, we don't take care of you and we don't feed you. Nobody walk away and say, we don't take care of you, we don't feed you. Oh, yeah. Hey, Bradley, have you ever been to Roderick's? I have not. Okay. 98th Avenue, across from Bishop O'Dowd. You said it's on 98th, across from Bishop O'Dowd. Roderick's Barbecue.